The fight over saving hundreds of rural hospitals across the country is now under discussion on the House floor in Washington, D.C. The Save Rural Hospitals Act is a bipartisan effort. WNCT's Josh Birch looks into what the impact could have in Belhaven.
Pungo Hospital once played a big role in the small town of Belhaven, but for the last year, the doors remain shut, an all too common reality for rural hospitals in the country.
Seeing this flood of rural hospital closures, 55. That may not sound like a significant number to some. For the rural patients they serve, it's a tremendously big number.
Maggie Elawani is the VP of Government Affairs and Policy for the National Rural Health Association. She says the Rural Hospital Act would help smaller hospitals by increasing Medicare reimbursements for care and reversing the bad debt reimbursement cuts.
It tries to solve the problem of why rural hospitals are closing, and then the other thing it does is try to provide a path forward to see that there is some type of new rural health model that makes sense in 2015.
One model suggested is the community outpatient hospital, where emergency care would still be provided 24/7 and transfers would take place in a timely manner for patients who require a higher level of care. This model would also recommend smaller hospitals set up a primary care clinic. Belhaven Mayor Adam O'Neill is a supporter.
Communities can customize their situation with health care to what's best for the community.
He's proud because he believes the walk he and others completed to D.C. from Belhaven earlier this summer played a role in introducing this act.
The purpose of the walk was to bring awareness to the crisis that we have in our country with 283 rural hospitals facing closure.
In Belhaven, Josh Birch, 9 on your side.
Now, folks with the National Rural Health Association say this act still has a long way to go before becoming law, but getting it introduced was a big first step.